It's Mari McInerney from Croaky here at the Royal Women's Hospital in Melbourne, where we're here for a grand round panel discussion about women in medicine. I have one of the panellists here who we can't talk to you after, but we're going to grab you beforehand, Dr. Skye Kinder. Skye, can you talk about where you're from and where you are in your training?
Yep, so I'm originally from Central Victoria. I'm currently a first year psychiatry trainee, and I'm doing that at St Vincent's Hospital in Melbourne, and I suppose longer term interested in rural mental health.
Fantastic. What are the main messages you're looking for here and also that you want to convey in the panel session?
I suppose one of the things when I think about medicine and where we still have to go is that medicine is often not a safe space for minorities and marginalised patients, because we often don't have that representation in our profession to really understand the issues that those people experience. And I think that really speaks to the need, particularly in rural areas, for example, to make sure that we do have women as prominent parts of the profession who might be able to, in some ways, understand, better relate, better represent the rural women that they are treating.
Because it tends to be seen as sometimes as a professional issue, but it's about patient care, isn't it?
Yeah, definitely. At the end of the day, we all, as people, identify with people who understand our experiences and who might have shared those experiences, and we might feel more comfortable to be forthcoming with things that we otherwise wouldn't be, and to seek care that, quite honestly, a lot of patients will actually stop seeking care if they don't feel supported by the health system. Our system, I think, is still really tailored to specific subsets of patients and not encompassing of all of the patients deserving of care.
And as to someone from a rural and regional area, what was the pathway like for you to get to study in Melbourne? Did you feel that you had specific obstacles?
Yeah, so for me, I think the path was somewhat long. There were barriers. I didn't get into medicine straight out of school. I went to a low socioeconomic public school in Central Vic, and so I ended up moving to Melbourne to do a bachelor's degree first, which being from a lower socioeconomic family was a bit of a struggle at times in terms of paying for rent and food and all of those sorts of things that regional students do have to navigate through. But I was very fortunate to get into Melbourne Uni medical school after my bachelor's, and I suppose now one of the interest areas that I have is supporting young regional and rural women, particularly in terms of things like scholarships, to ensure that they can pursue their sort of educational goals, because education is a great equaliser, I think.
What's the ratio like with that in terms of gender?
In terms of...
For scholarships?
For scholarships? I'm not sure, to be honest. I think we actually need a lot more funding for scholarships for regional and rural students across the board. I know that I was just at an event in Bendigo that was raising money for scholarships for local rural women to go to university, because they felt that there was a sort of a gap in the market in terms of that financial support. And I think, my personal opinion is that government needs to really invest in our regional kids and to help diversify our professions.
And in terms of that pathway now in medicine, what are you experiencing as a trainee? What's your observation of equity at work?
For me, in rural health, I have felt very supported as a woman. I actually think that rural health is one of the better areas in women when it comes to embracing who you are, whatever it is that you bring to the table, and putting forward women for leadership roles. That's not to say there isn't a way to go, but that's certainly been my experience so far. I know that that's not ubiquitous across all of the medical specialties though.
And just with getting your rural and regional health hat on, with the federal election coming up, do you want to nominate some big urgent areas?
Yeah, I think definitely further commitment to the National Rural Generalist Pathway is absolutely needed, and I think we also need to be looking at our regional training hubs and how we're using the funding there and how we can be better supporting trainee specialists to work in the regions as well.
Thank you so much, Skye. I think it's almost panel time by the noise behind us.